Let's start a show with a little history. In 400 BC, the Greek philosopher Hippocrates described the stroke phenomenon as sudden paralysis. So, doctor, what is the goal of stroke rehabilitation when someone feels this way and someone is recovering from something so massive?
So, Kathy, let me first explain what is my specialty. So, physical medicine and rehabilitation is a medical specialty dedicated to care and treat disability after injury or disease resulting from bones, muscles, nervous system, meaning brain and spine. Right. The rehabilitation doctor, like myself, we also are called physiatrists. We might lead a team of other disciplines and health professionals like therapy to care for the whole person, to treat pain, to restore function, and most important of all, to improve quality of life. And this improvement in quality of life should actually be the foundation of any rehabilitation program. Specifically in stroke patients, we as physiatrists can offer huge approach in the treatment of a whole person.
Right.
So it's very important for us to be able to be involved very early in the process after the patient is being treated.